So this one is EMRCS questions about post-operative management and critical care. Let's see the questions. Which of the following anesthetic agent is likely to be associated with myocardial contractility? Myocardial contractility. That depression means cardiac depression. Cardiac depression is caused by which of these agents? So cardiac depression is etomide. Etomide. Other agents, propofol has. So what are the uses of propofol? For rapid induction, sodium thiopentate is propofol is most commonly used. Rapid ketamine. The questions are on all this ketamine, etomide. So next question is 45-year man undergoes general anesthesia, depolarizing muscle relaxation. Patient is already getting depolarizing muscle relaxation. Agent is used and conclusion procedure comprises removal of simple skin lesion. The patient does not resume spontaneous, so reversal has to be done. The deficiency in which of the enzyme listed below is likely to account for this process. The reversal is delayed because of which enzyme? Pseudocholinesterase, because depolarizing acts by cholinesterase. So whenever there is deficiency in pseudocholinesterase, depolarizing muscle succinylcholine is a agent which is acting following a brief period of muscle fasciculations and depolarization. Recovery is spontaneously hydrolyzed by the enzyme. This is pseudocholinesterase enzyme which hydrolyzes succinylcholine within 4 to 6 minutes. If there is deficiency of this, then the patients. So pseudocholine's slightly reduced enzyme activity polarization may affect up to 20 minutes. In those, so it can extend up to 20 minutes. Non-depolarizing muscle even depolarizing. What is next question? 45-year man involved polytrauma, massive transfusion of packed cells are given. 3 hours develop hypoxia and CBP is noted to be 10. So bilateral diffuse infiltrate. So there is lung injury, acute lung injury, transfusion related associated acute lung injury, massive hemorrhage. What are these? Are the findings? Blood is refrigerated. Complications. Hypothermia is one complication. Hypocalcemia, because chelating calcium is there. Hyperkalemia, potassium is raised. Transfusion acute onset non-cardiac pulmonary edema is there. Transfusion deaths. Next question is 17-year man undergoes electrophysiology post-operative releases 6 liters of sodium chloride. Suddenly sodium chloride is given hyperchloremic acidosis, because sodium chloride contains maximum 153 sodium chloride. 73 man develops the DIC, falling abdominal aortic. He receives infusion of cryoprecipitate. Major constituents of cryoprecipitate is factor 8 is a major constituent of cryoprecipitate. Which of the drugs listed below confers greater risk of malignant hypothermia? Temperature raise, dexamethasone. Again, it has gas depolarizing, that's why it causes malignant. 72-year man with prostate cancer admitted to urology with retention and complaints of back pain and not responding to ward analgesia. So this patient is not responding to simple analgesia and lumbar vertebral metastasis. So appropriate is radiotherapy to lumbar spine. This is one of the painkiller. Radiotherapy, local anesthetic, spinal anesthesia, epidural anesthesia, transdermal black, different types of patient control anesthesia. Strong and opioid analgesic is morphine, short half-life, but applies in liver. Pethidine synthesis opioids, it is not, has 10% potassium morphine, short half-life. Weak opioids, codeine and all the non-opioids, paracetamol and NSAIDs. Neuropathic pain. First line is amytryptyline in neuropathic pain. Second line is pregabalin. Pregabalin is also for neuropathic. Third is tramadol. Diabetic duloxetine. These are the drugs important for diabetes. National Institute, NICE guidelines for neuropathic amytryptyline or pregabalin. Second, you add amytryptyline and pregabalin. Third, refer to the pain specialist, you tramadol, interim, avoid morphine. Then duloxetine. First, pregabalin, class D control drugs, misuse of drugs. 74-year man is admitted for the transient ischemic attacks, which he takes TIA. TIA. Stop 36 hours prior to surgery. In recovery room, he noted signs of bleeding in the wound. So bleeding is there. How will reverse? Because of platelet dysfunction. Bleeding is because of platelet dysfunction. Which of the agent listed below also with strong antiemetic properties? So whether it is thiopentone, sodium, etomidate, ketamine, antiemetic is propofol, because this is the propofol has got antiemetic property. Again, you have to remember these things. These are just memory based. That's why again you have to repeat this. Propofol antiemetic. 43-year man is intensive care unit for a week. Adult respiratory distress syndrome complicating acute pancreatitis. ARDS. Ventilation, mechanical ventilated. Ventilation is still mechanical ventilated. What is the best option? Now airway has to maintain in ICU, so you have to go for tracheostomy so that you can prolonged intubation in that. 55 man with comorbidity will undergo milligan hemorrhectomy. Which proper method delivering immediate post-operative analgesia? Putative nerve release, caudal block is there. Caudal block following severe pain. Caudal anesthesia. Caudal anesthesia when is not putative block is alternative but less effective initial. So this is another question regarding man 45 intensive care unit. He has central line pulmonary catheter. So everything is low systemic resistance. High means it is in hypovolumic shock. Hypovolumic shock. 4 centimeter lipoma, ASA grade 1. Which of the following is listed below is associated with hepatotoxicity? Halothine is HH hepatotoxic. 28-year patient control Crohn's disease, nutritionally compromised decision is made using TPN. Which of the following route should be administered? TPN here, total parenteral nutrition, Crohn's disease. So whenever you want to give TPN, it will be sent internal jugular vein is the best. 63-year man undergoes subtotal colectomy and iatric injury to both ureters. Sustained renal failure. Potassium is found to be elevated 6.5 in ECG. Perform. What is most likely? When there is potassium, there is peak T waves. Which of the following is not to include total parenteral nutrition? Total parenteral fibers are not there. Lipids are there, potassium is there, glucose is there, magnesium is there, fiber is not there. You are thoracic register, patient referred for the aortic valve replacement. Whatever investigation, progressive breathlessness, new respiratory shows more than smoking. Pulmonary test FEV1 1.4, FVC 1.7, so 1.4 divided 1.7. It is around. They are already given. It is 82. 82 means it is more than 0.7. So restrictive. This will increase. Obstructive, this will decrease. Restrictive will increase. So you have to think of decrease or increase. So this is obstructive, this is obstructive, COPD is obstructive, and laryngeal malignancy is again obstructive. So this one is restrictive. Which of the following muscle relaxant is agent that is used for hydrolysis to produce histamine release? Atracuronium. This is atracuronium. A causes histamine. Atracuronium. We are most likely to induce adrenal suppression. Suppress adrenal. All are memory based. Just etomidate. Keep remember, because cardiac depression is also by etomidate. It is also adrenal suppression. Cardiac safe. Cardiac is safe, but it is adrenal suppression. Pethidine is not like morphine. This is the question. This is Answer, it's not like morphine. "34-year man septic shock receives infusion dextran. Which of the following complications may ensure anaphylaxis?" Dextran is anaphylaxis. 23-year man recovering from appendectomy operation has been vomiting and now fully administered pending analysis of urea electrolytes. Which of the following interval may be initially? Hartmann's is always given. Difficult juxtarenal position, repair and preparation difficult as it is juxtarenal position, supra clamp post-operative found oliguric and acute renal failure expected. Which of the following statement relating to acute post-operative renal failure is untrue? Acute post-operative renal failure. Intravenous dopamine does not prevent acute renal failure. It is more of an emergency use of excessive amount of vasopressor or strong renoprotector. This is the answer. It doesn't protect. Which of the following muscle relaxation is least likely to result in which of the muscle? Which of the following muscle relaxation is likely to result in histamine attack? Again, the same question. Use of which of least likely? This is least. Drugs like atracrenum cause histamine release, and vicrenum, so saxamethonium cannot release. What is the purpose of release of histamine? Because histamine release atracrenum non-depolarizing. This is non-depolarizing. Duration action is slow. Histamine release administration may produce facial flushing and tachycardia and hypotension. That's why it is important. 58-year man is due to undergo hemicolectomy to treat ascending colon cancer. Planned procedure. Surgeon decides to enroll patient in enhanced recovery system. Which of the following intervention listed below also with reduced efficacy of? So this is definitely okay. This is okay. This is okay. Early motion okay. So this is IV fluid loading regimes. This should not be given. That decreases enhanced recovery program. Too much IV fluid should not be loaded. Which of the agents listed below can be administered via peripheral IV route in non-cardiac arrest setting? Cardiac arrest. So you can give non-cardiac arrest setting. It is milrinone or metronidazole. Is an alpha receptor. General inotropes and vasopressor are administered via central vein. Inotropes and vasopressor. Metronidazole is exception. It can be used in the patient with locally advanced pancreatic cancer, persistent back pain. You have to go for nerve block. "54 man admitted to the elective 3 days post-operative suspect pulmonary embolism. 3 days. Blood pressure is okay. Chest. What is the definitive pulmonary coronary CT pulmonary? 25-year male pedestrian road must multiple injury, intubated and ventilated. Next, we develops ARDS. Main reason for hypoxemia. Why does it occur? Increased lung compression. Diffusion is decreased. That's why develops hypoxemia. 50-year male, 70 kg is unwell, intestinal failure. He become malnourished. What is the most appropriate calories? So malnourished 10 kilocalorie per kg. into 70 equal to 700. Which of the following agents have strongest analgesic effect? Ketamine has got good helicopter. 48-year man to undergo laparoscopy for a small operation. What is the best option? Maintaining airway. Obstruction is there. 48 age year. Endotracheal intubation. That to be cuffed. Administration of neostigmine to the patient who has received non-depolarizing already, so it can cause bradycardia. 72-year man, vascular clinic, having an amputation 2 months ago. He is having sleeping at night due to persistent tingling at amputation site. What is most appropriate analgesic? Now, this is diabetic tingling, pregabalin. This is the first. Phantom limb, neuropathic pain, pregabalin, duloxetine, morphine, everything is given. So now there is pain ladder, local anesthetic, spinal anesthesia, epidural, tab block, patient control, analgesia, morphine, pethidine, weak analgesics, neuropathic pain. This the first line is amitriptyline. If not, so if it is amitriptyline in the option, that is the first line. But patient is difficulty in night due to persistent tingling amputation known to orthostatic hypotension. First line is amitriptyline or pregabalin. However, this patient which is side effect of amitriptyline. Orthostatic hypertension. That's why pregabalin is used. 24 man is recovering from right hemicolectomy of Crohn's disease. He is oliguric and dehydrated owing to high output ileostomy. His electrolytes are normal. Which of the following intravenous fluids? Oliguric, high output ileostomy. Ileostomy means what will be the loss will be potassium and water. So you need Hartmann contains the potassium. That's why. Which of the following is not diagnostic criteria of brain death? So no response to sign is not again, no coronary reflex, no response. Which of the following muscle relaxant tend to incite neuromuscular excitability, succinylcholine muscle? 22-year outfit undergoes emergency episiotomy. He is successfully inflamed appendix and arrival recovery. Patient develops tachycardia, temperature, hyperthermia. It is again malignant hyperthermia by succinylcholine. Which of the statement regarding post-operative cognitive impairment? Cognitive impairment is true. Use of benzodiazepines reduces cognitive impairment. This is good. Which of the following does not need monitoring during home parental nutrition? So folate levels need monitoring, zinc level, vitamin D, thyroid does not need monitoring. Every day you don't do. 42-year male is recovering from right hemicolectomy carcinoma. Surgery is unconventional. Oral resume. It should be within 24 hours. Right hemicolectomy, within 24 you can start. Significant laparotomy, nephrostomy, vascular injury necessary 6 blood transfusion, prolonged recovery, ventilator 2 weeks, intensive care and transfer to the ward. On reviewing his routine blood, HB, platelet, WBC, sodium and electrolytes. This is because of total parental nutrition. Cholestasis may result from gallstones to form. Which of the variable is considered to be sequential organ failures? not considered SOFA, sofa, lungs, liver, heart, brain, blood, so lungs FiO2, bilirubin, heart you measure BP, brain you measure altered mental status, glaucoma scale, platelet, kidneys. So you measure create. Q SOFA is RR, BP, AMS. How many of these findings? Pulmonary, low, high, low, septic shock. Patient admitted to the ICU. He has central line pulmonary catheter inserted, falling or obtained. Pulmonary catheter high, cardiac output low. SVR is systemic vascular resistance is very high. Hypovolemic, cardiogenic shock. This if increase, this leads to cardio. A man to have a surgical unit over next few days become dyspneic and saturation chest and bilar infiltrates. CVP is 16. Respiratory stress syndrome. 20-year man with Crohn's disease undergone number of resections. 18. BMI is low. Localized perforation small bowel. Giving azathioprine most operative device. Which of the following agent is most likely to help in controlling refractory hypotension, refractory low BP, and pyelonephritis? So you think of any drug which is not nephrotoxic, it is non-adrenaline septic. Ketamine dissociative anesthesia. Shooting pain after mastectomy is not clearance. What is the management of shooting pain? A 48-year man is recovering from high dependency following long-term complex lobotomy. Post-operative medications include AC inhibitor, blood pressure from oliguria. What is the most appropriate immediate course? Administer fluid challenge. Six-month-old operative post-operative paracetamol. Caudal block. Which of the agent listed is phosphodiesterase inhibitor? Phosphodiesterase. These are memorable questions. Memory needs milrinone. 25-year-old man is in root of his right tibia is fractured. He man in the fasciotomies. 48 hours in his serum rises urine microscopy. Muddy brown myoglobin is there. It is acute tubular necrosis. Flexible endoscope is there. 5 mg metazolam for sedation. After 3 minutes, noted to hypoxic respiratory rate is administered at this point. Women admitted were ruptured, moribund, hypotensive. Right new amputation, stage vascular disease, clinic was over, busting bleeding, discomfort, amputation, and system. Which of the following is not in total parental nutrition? It may be caused by steroids and result of liver function test. Steatosis. Inguinal hernia, COPD. Tolerance, he has exercise tolerance of 10 yards. Pitting edema on thighs. Thighs, COPD 2, 3, 4. Chronic schizophrenia undergoes cholecystomy. This is metoclopramide for operative nausea. 2 minutes later, he becomes agitated and develops marked oligochitosis, prostacyclidine, which of the following may elevate the symptom. This man developed acute dystonia and administered further anti-dopaminergic drugs. Which of the following is least likely suitable for 23 man with the burns and tibial fractures? 2 hours. Least suitable is suxamethonium. 43-year man on ward 5 following high resection, 12 hours. Increasing abdominal pain and fever, atrial fibrillation absent. Peg tube. 55-year man undergo appendectomy and through lower midline laparotomy is the most appropriate model for post-operative analgesia. Post-operative analgesia, patient self-control. Most appropriate analgesic administered to the neonate who is recovering following inguinal hernia is paracetamol. So 37-year-old involved in rotor of action, spleen is ruptured and a major hemorrhage, splenectomy, deteriorate. Most of the cause is still development process. 729 esophagectomy for malignancy. BMI is very low. Esophagectomy, jejunostomy. Midazolam, undergoing colonoscopy on midazolam, her respiratory rate is low and becomes hypoxemic, and this is reversible. Flumanazole.